And I am the moderator for today's topic, or rather subject. Thank you very much. Let me take this opportunity to thank you all, those who have joined and those who are going to join. We have a very important topic, or rather subject, that we need to discuss on. It is on quality management and reporting. Once more is that I want to introduce our panelists. We have our key speaker, who is Dr. Julius Ogato, and he has sent, or rather a representative from the Ministry of Health. And as you can see, the presenters are Dr. Maturi, Peter, Ms. Alice Mbui, and Mr. Robert Njuguna. And we have discussants who are Dr. Dixon Muchana and also Dr. Dranera. I want to take this opportunity once more to say karibuni, and we have an interactive session, and welcome. Let me take this opportunity also to welcome our key speaker. Previously, it was supposed to be Dr. Julius Ogato, who is the head directorate of health care services in the Ministry of Health. But as I had alluded earlier, is that he has sent his representative from the ministry. And we are going to have Dr. Keegan Bartirol, who is the head of National Referral Services, Directorate of Healthcare Services. He is also a consultant of gynae. As we can say before he comes in, I want to say this as a introduction, is that matters quality. We know very well that quality is a process that encompasses all the procedures, and also it is not a one event. So on matters quality, when we talk about a national blood transfusion service, or rather in blood transfusion, it's a vein to vein, from the vein of the donor to the vein of the patient. And this topic is very important because matters quality, it cannot be compromised, simply because it is very important that we give services, or rather quality services. And for that, I want, as I had said earlier, we need to have an interactive session. Let me take this opportunity to welcome Dr. Keegan for the keynote address. Welcome, Dr.
Thank you. My name is Dr. Keegan, representing Dr. Ogato, who's the head of the Director of the Healthcare Services. I am the head of the Division of National Referral Services of the Ministry. Colleagues, ladies and gentlemen, it is my pleasure to deliver the keynote address this morning in the webinar session on quality management and reporting on blood services. I wish to convey a warm welcome to all the participants drawn from various cadres in health profession and various sectors in health. May it be the Ministry of Health, that is both national and county government, faith-based organizations, or the private sector. Article 43 of the Constitution of Kenya, 2010, on the Bill of Rights guarantees every Kenyan to the right of the highest attainable standards as a fundamental economic and social right. These include the right to healthcare services, such as reproductive healthcare and emergency medical treatment. If that means that access to transfusion services is part of the fundamental rights to health, and its attainment is one of the prerequisites for universal healthcare. The Department of Blood Transfusion, Tissue and Organ Transplant Services is one of the departments under the Directorate of Healthcare Services, and is responsible for ensuring equitable access of safe blood in the country. Kenyans have experienced an increased need for blood and blood products due to increased cancer cases, a shift in the epidemiological patterns of disease, population growth, and of course, our main issue of road traffic accidents. Cases of blood cancer are on the rise in Kenya. causing an increase of number of patients who need transfusion. Leukemia and non-Hodgkin's lymphoma are the two topmost blood cancers for children below 18 years. Postpartum hemorrhage causes 35% of maternal deaths, thus clawing back the gains made in reducing maternal deaths through investment in UHC, such as Linda Mama initiatives. Ladies and gentlemen, over the last 1 year, the ministry has embarked on changes and reforms that will align to the needs of the populace in terms of blood and blood products. Key areas of focus are: 1, development of policy on donations, transfusion, transplant of human-derived medical products. Number 2, development and review of guidelines and manuals within the blood ecosystem. 6 guidelines and manuals are already developed and are awaiting validation. Number 3, development of an intergovernmental framework to ensure that national and county government collaborate to attain self-sufficiency in blood and blood products. Number 4, investments in increasing blood collections in the country by opening more satellite sites across the countries and investing in infrastructure. It is with great pleasure that I want to welcome you to a meaningful participation in today's session on quality management and reporting on blood. Thank you. Back to you.
Thank you very much, Dr. Keegan, for the key address, and we are thankful for that information. And in case there's some reaction on the same, we are going to do it at a later time, or rather later during the meeting, or rather the webinar. Allow me this time around to welcome our first presenter of the panelists, and he is Mr. Robert Juguna. Mr. Robert Juguna is a senior accreditation officer working with KNS, and this is the body that normally is involved in accreditation process. And let me take this opportunity to welcome Mr. Robert Juguna. Mr. Robert Juguna, you can carry on. Mr. Robert.
Okay, thank you very much. As you have heard, my name is Robert, and I am here to do a presentation on the quality in blood transfusion services, and I'm looking at the broad picture. I'm going to share my slides. Please let me know if you cannot see the slides. There we are, okay. So thank you so much for giving me this opportunity. As you have heard, my name is Robert from Kenya Accreditation Service. My short presentation will be on the quality in blood transfusion, and I will only be looking at the broader picture. And the other presenters will zero in on the specifics in blood transfusion services. I will start by giving some key definitions. Quality, we know quality is very important. So I'll start by giving some definitions for the quality and how it applies in the blood transfusion services. So quality, simply said, is a consistent and reliable performance of services or products in conformity with specified standards. The key word there, specified standards, is very, very important, because we know in the blood transfusion, we are dealing with the blood and blood products, and each of those products has some specified standards that they must meet to be suitable for safe transfusion. So quality here is simply fitness for purpose. And when we talk fitness for purpose in blood transfusion, we are talking about nothing else other than safe transfusion. So going with the quality is the quality management systems. We must have quality systems in place so that we can be able to manage our processes. So then what is the quality management system? In this regard, we are talking about the organizational structures processes, procedures, and resources which are needed to implement quality requirements. Okay. And then there is a quality assurance, which is also very much related. And then in quality assurance, we are simply saying that it is how do we assure quality now that we know quality. So we are saying is creating an operational and standards programs and effective management system to ensure quality. So this is to operationalize the quality, we have to create standards and programs, and we must have effective management of the system so that we can assure quality. Okay, good. So why do we need quality assurance, or why do we need quality in the blood transfusion? So we're simply saying that quality assurance is going to minimize the risks to safety and quality by ensuring that our blood bank processes are reliably deliver safe, efficacious blood and blood components. So efficacious, we know when we talk about that, we must have components that have the required parameters like coagulation factors that are needed by the patients. So again, these components and blood products must be collected and manufactured in a manner that causes no harm to the donors or the staff. So of key interest when we're talking about quality assurance in blood transfusion is the safety of the blood, and that is the concern here being our patient, and also protection of our donors from harm that may be inflicted during the processes. Okay. So another term that I need to just highlight here is the quality assurance and quality control. And quality control is just a subset of quality assurance. And the quality assurance is a broader picture. It is process oriented, while our quality assurance deals with particular products at a time. And then here we are talking about prevention of non-conformities, prevention of defects, while in the quality control is actually identification of the defects. The quality assurance is a proactive process, and the quality control is reactive to the defects or any non-conformities that may be identified and how to manage those defects. And of course, quality assurance, being a broader picture, is a managerial tool, while a quality assurance or quality control, which is a subset of quality assurance, is a corrective tool. So where do we need quality or quality systems or quality assurance in blood transfusion? There are key processes or critical processes in blood transfusion that we all know that require that we need to integrate quality aspect in each of them. And starting with the donor recruitment, the objective here being that we only end up with a suitable donor, and we are able to defer any high-risk donors. Collection, handling, and transportation of blood before processing. If we don't have quality systems in that, it means that we are not going to have end products that meet the specification. We need to demonstrate quality in the laboratory testing and screening, and that is coming with good laboratory practices. And then when we are manufacturing our products, we need to demonstrate good manufacturing practices so that we can end up with components that are safe and efficacious. And then we talk about labeling, storage, blood, and components, and then the distribution. All these key processes require a quality assurance program so that at the end of the day, we can end up with a product that can be said to be safe and efficacious. Okay, what are the quality requirements or quality management system requirements in blood transfusion. Like any other quality management systems, we have key essential aspects of quality management systems, and they include documentation and document and records management, process control, the processes that we have seen above there, and it requires to have good laboratory infrastructure and equipment. We talk about material management, where we are talking about consumables and reagents, things like blood bags and such. And we talk about blood and blood components, information management, identification and management of deviations, and then we have evaluation activities, and these include process audits, risk management, and management reviews. So I'm just going to highlight on a few of these and how they apply in the blood transfusion services. So starting with the documentation, that is the hierarchy of documentation. At the apex, we have the policies and the manuals, all the way up to where we have the records. So as we all know, that it is very important that we have very good guidelines, which are not only used within the blood transfusion services, but also used nationwide by the consumers of blood transfusion services. So it is important that we have guidelines that are properly reviewed and contain all the policies and regulations for the blood transfusion services. From the policies are translated into actions by procedures, and these are commonly referred as SOPs. These ones needs to be in all processes. All processes need to have procedures, instructions for use, practices needs to be documented, and records must exist as evidence of compliance with the standards that have been stated in the policies, manuals, and procedures. So this documentation helps very much in avoiding errors and deviations. When the people and the staff are using documented procedures, there is consistency of practices, because staffs are going to do the same things as documented, and there will be elimination of errors and deviations because they are following standard procedures. When we come to records, it is very, very important to have records that shows the complete chain, a production chain, from when we obtain the blood from the donor to when we transfuse, so to say, the vein to vein. And this can only be assured that if we keep records for each and every process in the blood transfusion services. So it is very, very important that we have procedures in place, policies in place, guideline documents in place, and we must show that these have been implemented by generating records as evidence of complying with the standards. So what about the management processes? We have key processes that we have identified, and we must have quality control point at each critical processes. That includes the selection of donors, collection, processing, testing, storage, and release, and transport. It is very important that we have periodic reviews of documentation for every process that we have. Documentation from the time that the donor walks in to the time that the product is actually transfused. And we need to have control over the over the components, where we need to be having periodic sampling and testing at different stages of shelf life for the products, blood and blood products, to ensure that the specifications that have been set have been met. Okay, so this goes also hand in hand with the quality control of the processes, like testing processes, at intervals that have been specified. All the equipments need to be quality controlled so that we can be sure we are delivering a good products and services. So we use, of course, quality control goes hand in hand with the quality EQA or external quality assurance, which is mandatory that we must have all the processes, testing processes, including the cross-match, the grouping, and the TTI must be enrolled, mandatory enrolled on EQA so that we can have external review of our processes. Okay, so going forward, we look at laboratory infrastructure and environment in which the production and testing is done. We need to have control and monitoring of environmental conditions, and environmental conditions include things like the temperatures, humidity, dust, light, vibration, all those that can affect the validity of results when we are conducting the screening, and also the quality of the blood components. So it is key that the environment provides for an environment conducive for us to be able to produce products that meet the specifications. We want to eliminate things that like contamination on our products like platelets by ensuring that we have an environment that promotes safe processes. Okay, then evaluating performance of equipment or the equipment that we use they need to be pretty much very much evaluated for performance. That would include method validation and verification before we can start using them. Operator training needs to be done for every piece of equipment.
Mr. Robert, are you still on? Mr. Robert? I think we have lost Mr. Robert. Dr. Evelyn?
It would seem.
Can I be heard now?
Go ahead, Robert.
Yes, go ahead.
Okay, good. So where was I? Let me go back to sharing my slides. Sorry for that. I think there was an issue with the speaker.
And Mr. Robert?
Yes.
You have 5 minutes to wind up.
Okay, very good.
Yes.
I'm going to wind up in a moment. Okay, so we're talking about the material management, and here I said that we're talking about blood collection packs, and they need to be of good quality. Testing reagents must be subjected to proper quality checks to determine suitability before use, and continuing suitability must also be checked by running QC and EQA. We're talking about quality assurance practices to apply to specification for materials and requirements for purchasing, receiving, inspection, storage. All these things need to be in place so that we can ensure that the materials that we are going to receive for use have been proper for use and are not going to compromise our products. So the storage conditions for the materials also need to be good enough. And then the defective materials, once identified, should be segregated and should not be used for processing our donor products. So what about the components? We must we come up with establish and document specification for each component. If you're talking about the platelets, we need to know what is supposed to be, how many platelets that are supposed to be in a unit of platelet. The same for packed cells, the same for cryoprecipitate and such. So we have to establish the specification first. Secondly, we must have procedures for testing the products to establish stated frequencies so that we can determine that the products meet specification. And then there must be documentation of ongoing testing to determine that components meet specification. Documentation of any deviations, identification of any affected batches, and recall of components that do not meet specification. So the blood transfusion services as such needs to come up with the specification for the products and the routines for testing. So the other requirements for the QMS is identification and management of deviations. These are critical service, blood transfusion, and any deviations or non-conformities can impact on the products and eventually the health of the recipient. And therefore, there needs to be effective quality assurance programs to enable non-conforming processes and products to be identified. Investigation of root causes of deviations needs to be there, followed by preventive and corrective actions to eliminate the deviations and non-conformities. And of course, finally, recalling of non-conforming products with parameters that may be below what is specified. And also evaluation. Our quality management system has to have a mechanism for evaluating our processes. And those evaluations include, but not limited to, audits, risk assessment, management reviews. So why do we audit the system? We want to audit to check if practices comply with established standards. We want to audit to determine that the QMS is implemented, effective, and maintained. And we want to also conduct risk assessments so that we can identify risk in the entire manufacturing chain of blood and blood components and establish potential risk factors that could impact on product safety. And this is something that is routinely done and should be evidence to show that once we have identified the risk, we come up with actions to mitigate the risks. And then we need to set up quality indicators to monitor performance of key processes. I think each of the process should have a quality indicator. And then finally, we conduct management reviews of the BTS services to check the overall performance in key process and determine the key here, the objective. We want to determine the needs for actions and resources to improve the services. And then finally, my very first slide. How do we provide confidence in blood transfusion services? Of course, accreditation comes in. There are many forms of accreditation. There is ISO accreditation to ISO 15189 that covers the components, mainly the testing aspects, not really with the components. There is AFSBT accreditation. There are other forms of certification such as good clinical practice and good manufacturing practices. That is the best way to provide confidence in blood transfusion services. Thank you very much for listening to me. And that is the end of my presentation.
Thank you very much, Mr. Robert Njuguna, for that elaborate discussion about, or rather, discussion about the quality in BTS or blood transfusion services. I would like also to thank those who are joining. So far, we have participants who are about 309. I encourage you to remain, and also there is a quorum on questions and answers. Please, if you have a question, you can just write it, and we are going to respond to that at the end, towards the end of the webinar. Let me take this opportunity. I know very well that the 312, or rather the participants, those who have joined, they are from various places and various countries. I'm encouraged to see that at least you are interested on how, or to know exactly what KNBTS is doing on matters quality in blood transfusion. Allow me to take this opportunity to welcome our second presenter, who is Madam Alice Mbui. Madam Alice Mbui is the QMS manager at Kenya National Blood Transfusion Tissue and Human Organ Transportation Services. And as the first presenter have alluded, is that Madam Alice Mbui is going to tell us, or rather to indicate, or rather to say what the KNBTS is doing to make sure that our product, our components, our blood is safe and it meets international standards. Over to you, Madam Alice. Thank you.
Good morning.
Alice?
Thank you, Mr. Washira. Good morning, participants. I'm glad to join this webinar and to be able to give you a brief overview on where KNBTS is as far as quality management systems are concerned. In my brief presentation, I'll be able to give you an overview of the current situation of QMS in Kenya National Blood Transfusion Services, what we have as ongoing processes, our reporting requirements, a way forward, and the lessons that we've learned in the process of implementing the quality management system. These are some of the areas that I'll be focusing on in my discussion. Move on. Next. So like we've heard from the previous presenter, in regards to requirements as far as quality is concerned, and I'll start by saying that quality and safety and efficacy of products transfused is a result of many requirements. And I do also reckon that in the opening, we say that it's not just an event, it's supposed to be a system or a day-to-day procedure. So for us to ensure that quality has been maintained or implemented within KNBTS, we've had a review of some guidelines and manuals that give the policies and processes that are involved as far as maintenance of quality in blood is concerned. And listed here are some of the guidelines that we've had revised and developed new ones. And just to mention, the guidelines on appropriate use, cold chain, hemovigilance, national standards for blood transfusion service, support supervision, and even guideline on establishing blood transfusion services. And this in particular is especially when we need to set up a new blood collection site, what are the must-haves in terms of room space and personnel. Next slide, please. In terms of infrastructure and equipment, for us to be able to ensure that the quality of products that we are producing, we've managed to refurbish our buildings. And this is in respect to environment, to donors, and even to the staff who are working there to ensure there's no issues of components being compromised. To again ensure safety and quality of the components, there's increased refrigeration capacity, then Again, in terms of appropriate use, we've had procurement of additional production and storage equipment to ensure that at least in every region, you're able to prepare the components and store them appropriately. And we do know cold chain is very key. So in case of power outages, now there's backup in all power backup in all sites, also to ensure that the storage has not been compromised, or even the testing services has delaying the availability of that rare commodity. All the equipment to ensure their functionality, just like we've had in the previous speaker, are now undergoing timely service as well as preventive maintenance. Next slide, please. To ensure that we are able to implement and maintain the quality management system, as well as to be able to audit our processes. The personnel have been trained, at least to give them an idea of what QMS is about and where we need to check and how we need to do those checks, what needs to be detected in case there are errors, how they need to be investigated and how they need to be resolved. Again, to ensure confidence to our customers, we've had 3 laboratories or regional blood transfusion site accredited under ISO 15189, and these are Nairobi, Nakuru, and Eldoret. And really, for us to achieve this, we had to ensure we were aligned to the requirements of the standards, that is our quality manuals, procedures, and key was the commitment by both staff and the management of KNBTTS. Next. On good manufacturing practices, we are striving to ensure that we've undertaken sterile blood collection processes, that is to ensure that all the donor preparation is done in the correct way. Again, closed system during collection. We are able to undertake apheresis platelet collections to ensure that at least the yield, the platelet yield suffices what the recipient needs. Then when we undertake component preparation, we ensure that there's no chance of opening the blood bags, hence introducing any bacterial contamination. And after preparation, we ensure that all our units and components are uniquely labeled as per the internationally acceptable standards. And after the preparation, again, there's improved storage capacity, and we always ensure that all the components are stored within the agreed or the recommended storage temperatures, timelines, and where issues like platelets that need to be continuously agitated. We ensure that all the sites that are preparing components have those storage devices that will ensure that our components are of quality throughout their shelf life. As part of the quality assurance, we are undertaking quality control measures, and part of that is the automation of testing, hence minimizing errors, and also using the highly sensitive screening methods to ensure that there are no chances of missing any infections, hence ensuring safety of the blood that we are transfusing to the patients. At the same time, undertaking quality control within the testing and the grouping processes. We also have elaborate donor screening prior to apheretic platelet donations, ensuring that we've ascertained what the platelet counts for that particular donor is and whether the donor is well. Also, to some extent, we are now able to undertake quality control for the whole blood, some of the parameters for platelets, as well as for the packed red cell components, and those QC parameters as listed. We do know hemovigilance plays a very big role as far as quality management is concerned, and now we are engaging all players in the health as far as blood transfusion is concerned to ensure that our hemovigilance system is strengthened and there are no issues that are missed out that could otherwise resort to unsafe blood or compromised quality of the components that are to be transfused to a patient. So what are our ongoing implementations? And the moment we are in the process of implementing the blood management information system that is going to allow us to be able to track and trace a blood unit from vein to vein. And also this applies to the donor. We're able to have all the donor information in case we need to do recall or even need to reach out to the donors of the rare blood groups. And even the process will be able to have at least a registry for all those rare blood donors, and even the donors who might be needing special components in the way of managing their health issues. Then going forward, it is the wish and the intent of KNBTTS to have all the blood establishments registered to use a donation numbering that ensures a globally unique identification of blood products, such that if a unit is collected in Nairobi and it's found somewhere else in Mombasa, it can still be linked by the name of the site that collected, and even the component name, time of preparation, and all that, including its expiration date. Then on reporting requirements, we have revised our tools, and we are now able to report on daily, weekly, monthly, and even quarterly basis. And this is both for the health products and the non-health products, even the hemovigilance tools that are going to be telling us where we are, where we need to put more emphasis. And then there's also big focus on reporting of quality indicators, and this will help us in planning on which areas need to be again focused on. Strengthened reporting of errors and incidences, and also non-conforming services and products, and thereafter their investigations. Also, timely feedback is now on course as far as blood needs are concerned. So again, to where we expect to be next, we wish to provide an evidence-based quality blood components. How do we need to do this? At least to introduce a QC for the fresh frozen plasma precipitate, and additional QC parameters for the whole blood, such as sterility testing, including for packed red cells, platelets, and things like the pH. Again, to be able to reliably manage the services and eliminate any errors in collection, production, and testing. There are also planned trainings on corrective and preventive action, and all those other trainings listed there. For all the sites to be able to prepare components, we are going to capacity build every key staff who is involved in that to ensure that they are also able to offer that service. Then introduction of preventive maintenance for the production, the storage equipment is on course. We've noticed that there are areas of weakness as far as cold chain is concerned, and therefore it is our focus to have that tightened to ensure that there is no compromised cold chain and therefore compromised quality. We do know that if we do not have enough blood, or we don't have the culture of donation, again, we run the risk of bleeding donors whose blood would be otherwise unsafe. And therefore, there's a focus of implementation of the strategy on blood donor recruitment, retention, and sustainability. At our satellites, we also need to strengthen the QMS to ensure that it's an all-round activity and also have a robust hemovigilance system. And then again, to ensure that we are also accredited under blood management that is through FSBT, that will be focusing from vein to vein, since currently we only have the testing, focus on the testing bit as far as accreditation is concerned. And within the course of implementing our QMS, we've learned that commitment is of key. We need to have competent staff, and communication is very crucial to be able to maintain and sustain the QMS. Thank you very much.
Thank you very much, Madam Aris Mbui, for that elaborate discussion. And I can say that at least we have had a robust, or rather, issues pertaining to quality are being taken seriously in Kenya National Blood Transfusion Service. If I happen to go through your presentation, and as we say that quality is a process, it's not a one event endeavor. And I know very well that you're going to endeavor as Kenya National Blood Transfusion Service to continue on improvement of quality for our products so that at least they can get into international standards, and we are there. This time around, allow me to also to thank those who are joining. I can see that people are joining, but questions not yet. On the chat side, I can say, and I'm going to discuss on what you have said at a later time during the presentation. Allow me this time round to welcome our final presenter, or rather, Dr. Peter Maturi. Dr. Peter Maturi is a clinical pathologist, hematologist, and a senior lecturer at University of Nairobi, and also working at Kenyatta National Hospital. Let me take this opportunity to welcome him so that at least he can go on or carry on his presentation. Thank you. Welcome, Dr.
Thank you, Mr. Washira, for the introduction. My previous speakers have already touched on most of the things that I would have wanted to speak about. So I will just, the next maybe 5 minutes, I am about to slide to just point out a few things, especially from the clinical aspect. I have seen a question from Dr. Sumba asking about, talking about why good clinical practice is important, and that is well noted. So so as a introduction, this was mentioned by
Dr. Maturi, kindly, we can't hear you.
Oh, you can't hear me? Hello?
Yes.
And now?
You are very faint.
You can hear me now?
Come
Hello?
a bit closer. Not yet.
Hello? Yes? Now? Can you hear me?
Yeah, Dr. Maturi, you okay? Yes, a bit okay.
Yes. So the blood
Doctor,
service,
if you're able to put the mouthpiece next to your mouth, then we'll be able to hear you better.
putting it next to my mouth, eh?
Okay, now we can. Now better.
You can hear me, eh?
Yeah.
Okay. So Dr. Keegan mentioned very well that the blood transfusion service is a vital part of the healthcare service. So I don't need to repeat on that. But we also know that there is increased advancement in the field of transfusion medicine, and there's a lot of technologies that are coming out. And this is necessitating what's now the enforcement measures to ensure that there's continuous quality of blood and its products. And we know that even with the highest level of standards, the best of equipment, best of trained personnel, there's always an inherent risk in blood transfusion. And again, this behoves the purpose for us continuing with the quality assurance program in the blood service. Next slide. So what are the threats to quality and safety of blood? The main threats, as our previous speaker said, insufficient number of voluntary non-remunerated blood donors to ensure an adequate supply of safe blood and blood products. That's a threat that because now we get blood from our relative donations, from commercial donors, and we know these are not safe. They are not the safest. That is one of the threats. Another threat is the risk of transmission of infections, such as HIV, hepatitis B, C, and syphilis, through unsafe transfusion. Again, maybe because of poor testing or algorithms. But again, we miss out on other infections. Remember, we have malaria, we have other viruses like Epstein-Barr virus, the Western Nile virus.
Hello, we can't hear Dr. Maturi. We can't hear him at all.
At all. Hello?
We can't hear you. You are very, very low. It's like you are calling from Iceland or Greenland.
Dr. Maturi? Yeah, as Dr. Maturi adjusts his gadgets, let's give him time, maybe 1 minute. Yes. Meanwhile, I urge, or rather, I encourage our participants, or rather our participants who are around 400, 350, to continue with their questions, and also on the chat side, give your views and
Yes.
your views.
Hello.
Yes.
Welcome.
Yes.
Yeah, now we
I'm
can
sorry
hear
for
you.
that. Now you can hear me.
Welcome
Yeah?
back. Yeah.
So I think also on the next, the second slide, that threats to quality and safety of blood. I just mentioned that the insufficient number of voluntary non-donated blood donors, relative donations, and commercial donors, who we know are not the safest donors for blood, but also the risk of transmission of infections. I've mentioned the HIV, hepatitis B and C, and syphilis through unsafe transfusion. Of course, as I said, this is because of poor testing algorithms, maybe not as advanced, especially if you're using rapid testing. That is a threat to quality assurance in blood. But you also miss out on other infections. We mentioned malaria, Epstein-Barr viruses, Western Nile virus, other viruses like TLV, which are prevalent, we know are common in our blood and not easily detected. So in a blood service that wants to achieve the highest standards, there needs to be continuous epidemiological studies, basically to identify any of these threats, including COVID, as that has been done. And of course, introducing better testing algorithms, each introduction of NAT testing, that's more specific or more sensitive testing for viral infections, and maybe having even a reference lab that can be able to test at the highest level of infectious testing. Yeah? And then on unnecessary transfusions, which needlessly expose patients to the risk of acute or dead reactions, and of course of transfusion transmitted infections. For example, when a doctor asks a request for transfusion of 1 unit, there's absolutely no indication, okay, not absolutely, but generally, there's no indication for transfusing 1 unit of blood. That if someone needs 1 unit of blood, then that person does not need any transfusion at all. And also transfusion of whole blood, we know again the inherent risk of transfusing whole blood, and that's why NBTS has gone towards providing products which are safer, because we know whole blood will expose you to all other adverse reactions that are inherent in the products that are in that blood. So next slide. So records are very important. If it's not recorded, it never happened. We know that very well. It's the most common violation. So there needs to be thorough record keeping. It's very essential. Records recreate every step related to the production and distribution of blood components, including individuals involved. That has been, very well elaborated by my previous speakers, very well. And that's very important for us in blood transfusion, especially following up last week's lecture on hemovigilance. Remember, we talked about traceability. So it creates an audit trail that's necessary to investigate errors. So record keeping is a very crucial aspect in that. Next slide. So as I conclude, I'll talk about the cost of poor quality. And this is something that most of us never think about. What does it cost us when we do not have a quality assurance program, or when we do not adhere to issues of quality? It's a cost based associated with providing poor quality products or services to our customers. In business terms, it refers to the total financial losses that are incurred by an organization due to performing incorrect things or procedures. So if you quantify how much you will lose if you have very poor quality systems, you lose about 15 to 40%. which means if you are receiving 1,000,000 shillings, 40% of that 1,000,000 shillings, about 400,000 shillings, goes to waste because of poor quality systems. So it's important to invest so that we save on this. So a well-organized blood transfusion service with a quality systems in all areas is not only a prerequisite for the safe and effective use of blood and blood products, but it also saves us the costs that are associated with the blood transfusion service. So thank you. That was my brief presentation. Shira, over to you.
Yes, thank you very much, Daktari, and for that elaborate discussion. Let me take this opportunity. I tend to think I got it right that you have discussed about the clinical aspect of quality in blood transfusion services and on the clinical area, in the clinical areas. And this is paramount, and it's very important that at least quality from the BTS also to the needy, or rather the clients who are our patients. So there's no way that we don't have any room for letting it go in terms of quality. It has to be quality, and I tend to think it's a chain to chain, or rather it is a process. Otherwise, thank you very much, Daktari. This same round, let me take this opportunity to now welcome the views of our discussants. And our first discussant is Dr. Dickson Muchana. Dr. Dickson Muchana is a consultant pathologist, and currently he is acting as medical superintendent at Kakamega County Referral Hospital. I am privileged to have known Dr. Dickson Muchana on those fairs, and I know that very well that Daktari, you have a lot of experience about the quality in your clinical areas, and also, yes, and that's why I'm saying is that it's important that at least you give us a view on those issues. Over to you, Daktari, Dr. Dixon.
Thank you, Mr. Mashira. Good morning, participants, fellow panelists and discussants, Dr. Thuranira. Indeed, it's a pleasure to be part of this discussion concerning blood transfusion. Blood transfusion is the cornerstone for healthcare service delivery, and as we know, we have no substitute for blood. So when one requires blood, they must get it. Safe blood in the quantity required, be it a different component, so we cannot run away from it. And quality is very important. Much has been discussed. What I may want to elaborate is in the quality improvement circle, the PDCA, whereby we have to implement policies, that is the do. We need to keep checking them so that they serve us, that is the check. We take action to improve uptake and improve their quality, that is the act. And we have to go back to the drawing board to identify what we need to develop and how we can modify our procedures and protocols going forward. Otherwise, quality, as much as it's costly to not to have it, it's also costly to implement. And in our overall day-to-day practice, we need to factor it in our processes. Those of us who are in the lab fraternity, we are trained a lot on quality, and it's our daily bread. So probably this need to be taken up in the other clinical, in the other areas of health, clinical, and you can start with the transfusion. The moment you receive a request for the blood, what are some of the quality checks that are included, even in a simple requisition, the lab request form? Quality starts from there. Proper information of the patient, transfusion, previous transfusion history, blood grouping, all these things need to be factored so that at the end of the day, we have safe transfusion. Otherwise, in Kakamega as a county, we have really focused on blood transfusion, and we comply to all the quality standards that are set by the KNBTTS. Thank you.
Thank you very much, Daktari. I'm happy to hear that in Kakamega County, you are adhering to quality checks and quality systems in our in BTS services at your county. I have also learned that quality is costly, and you have alluded to it that, but it is more costly if not implemented. So there is no way that we can excuse ourselves on issues quality, even if it's costly. Daktari has alluded to it that it is even more costly if we don't implement it. Others, thank you very much, Daktari, for your views. Allow me this time round to get my second, or rather to welcome my second discussant, who is Dr. Dranera. Dr. Dranera works in KNH, that is Kenyatta National Hospital. He is a consultant physician. He is not new in blood transfusion. We have worked and worked with him, and I know very well that he's wealthy in terms of BTS. Let us hear from Daktari. Welcome, Daktari.
Thank you, Daniel, and thank you for blessing me with a new title. I aspire to be a physician soon, but I'm in the line of pathology.
Sorry for that.
There are blessings. I work in the Kenyatta National Hospital, the Department of Lab Medicine, and I'm happy to be here. I'm happy to be in the midst of my seniors. Dr. Mchana is doing a very good job in Kakamega and the whole Western region. The KNBTS team led by Dr. Nduku Kilonzo, Dr. Evelyn Chege and the whole team, Alice and the rest, you're doing a very good job. So today's discussion was excellent. And I'll deviate a little bit and talk about what WHO says. And WHO has several strategies to improve blood safety and availability. And majorly there are four, and the first one is a well-organized nationally coordinated blood transfusion service, which we have under the able leadership of Dr. Kilonzo Nduku. The other one is collection of blood from regular, voluntary, non-remunerated blood donors from the low-risk population. We might not be achieving this much. We need to endeavor to achieve that. Then proper testing of all donated blood for TTIs, and also appropriate use, which is something I'll talk about. Then there was an excellent discussion from KNAS about accreditation, and I'm happy that there are 3 KNBTS centers, RBTCs, Nairobi, Eldoret, and Nakuru, to know that they are fully accredited. I think we should all aspire to be accredited, including our centers. Then Alice gave us a rundown about the quality management system that they are doing at KNBTS, and that proves to the masses, to us healthcare workers, and I think the general population, that we are doing a good job. We are getting safe blood to be given to our patients. Then my lecturer, my teacher, Dr. Maturi, really made us think out loud about the threats to quality and the issue of voluntary and remunerated donors vis-a-vis what we are mostly doing in most facilities, replacement donors who are relatives, and you know the risks that come into it. The issue of TTIs, the ones screened for and the ones that are not screened for, the transfusion reactions, and issues of record keeping and everything. And so finally, in Kenyatta, we have endeavored to come up with guidelines for blood and blood product usage The guidelines are ready for rollout, actually awaiting just approval by the whole team. Most of the people who work there and some of the team that is here have been involved in that. The second thing is that from on Wednesday's discussion, we were discussing about hemovigilance, and through this series, we have the discussants have really emphasized the importance of hospital transfusion committees. I think whichever facility that doesn't have this should come up with it. And there's a lot of issues that are sorted out using the hospital transfusion committees. Finally, we really need a conclusive, elaborate discussion on rational use of blood and blood products. As Kenyatta National Hospital, we are planning in the new year to do a series, like a 2-month series of discussing rational blood and blood product utilization so that the requests come with the indications and you get the correct units or the correct product issued. All that said, I enjoyed the discussion, and keep it up, KNBTS, keep it up, all the discussants, and let's continue doing this for Kenya and for our patients. Thank you so much, Washira. Over to you.
Thank you very much, Daktari. Thank you also for giving us hope and also encouragement that we have to continue endeavoring ourselves on issues pertaining to quality. I'm also happy that you have a vibrant HTC, which is a key, or that's a hospital transfusion committee, and also the good practice in terms of guidelines on the blood and blood products. I tend to think we are working in tandem with us as we check, or rather we look forward for a good partnership in terms of quality and also dissemination of those important information to our clinicians. Allow me this time round to welcome any sentiment from our panelists and also discussants, if there is any pending. Dr. Maturi? None. Anybody who have presented today that you feel that at least you have left something that was of importance for our participants? Yes. If there is none, then allow me also to go through questions. And our first question in this preliminary is from Robert. And he says, currently ISO 15189 audits only test for KNBTS. Which are the plans that you have, or you have developed documents that can audit or assess all KNBTS processes from donor recruitment to dispatch? Madam Alice, we have heard about ISO 15189, which only accredits laboratories. What is your view for other processes, or what is the stand of the Kenya National Blood Transfusion Service? Over to you, Alice.
Thank you, Mr. Washira. Actually, this question is meant for Robert to confirm whether, as an accreditation body, they have developed documents that can audit or assess. Yes.
Okay, but thank you very much for that question. It's true that the scheme that we have currently for ISO 15189 only covers the testing part, and that would only go to the preparation of samples for testing and reporting. However, as you know, the way KENAS is structured, there is room for creating more accreditation scheme. We looking forward and putting a proposal to create an accreditation scheme that is going to be called ISO 151+. And ISO 151+ is supposed to cover the testing and other blood donor services that should come on board. So the key is to identify stakeholders, and Kenya National Blood Transfusion being one of them, that in the very near future, we shall be talking to them on how to work on a new scheme for accreditation of blood transfusion services that is not only going to cover testing, but also include other key processes, including component production and such.
Thank you, Robert, for that answer, elaborate answer. And we are going to work together with you so that at least we can see to 8 other aspects that you can come in and assist. There's somebody by the name Benjamin who is.
Or call back later. Safaricom.
Sorry for that. Yes, can we mute, please, so that we can carry on? Benjamin is asking whether tattooing or tattoos can compromise the quality of the blood donated. Madam Alice, do you have any answer for this?
Okay, having a tattoo itself is not a safety risk. Usually the big risk is on how the tattoo was administered, or there tools or devices that were shared. That is usually where the risk comes in. Thank you.
Okay, thank you. I know very well that our participant has understood that tattooing is on the way it is done, that's the risk factor. Can we carry on? Somebody is just asking whether, or rather requesting whether we can have him get the slides for his own, whatever, consumption, or rather sharing and so forth. Do we have our panelists, or rather our people who are concerned with the system? Is it possible for them to get maybe those notes?
Daniel, I can answer that. Normally, this recording is uploaded in the KNH website under the webinar part. If you go to the website, you search webinars, you'll see the whole presentation there. So you can have it, you can access it throughout, and it's also posted on YouTube.
Thank you very much for that. Evans from Garissa County Referral Hospital, he is saying that some of the private facilities, they do blood screening for transfusion. How accurate are the machines are they using, and are they registered for those services? So we heard that there are some private hospitals who are carrying out on the TTIs, or rather screening. Can somebody, that's Dr. Maturi. What is your view? Dr. Maturi? Okay, let's go back to Madam Alice. Sorry for bombarding you with a lot of questions. Now that Dr. Maturi is not responding.
It's okay, Washira. I will first of all start saying that I may not have the answer on the last bit on whether they are accurate and whether they are registered, but I will say that we do have a testing algorithm for donated blood samples, and that has been provided by the WHO. So it is only by implementing that or getting to the ground that it can be ascertained whether that which is in use is what has been approved or not. And of course, there are guidelines on what kind of test kits that one needs to use, what kind of equipment one needs to use in terms of sensitivity and specificity, and what are the mandatory markers, disease markers that need to be tested. So it's interesting, and I think going forward, even as we embark now to undertake support supervisions in the transfusing hospitals, those are some of the issues that we could be giving guidance on, and again, based on our newly revised guidelines and standards of blood transfusion, because all that information is contained therein on what should be used and what should not be used. But again, safety is of utmost importance. Even as we embark on doing our own screening, we should put the safety of the patient first. Thank you, and back to you.
Thank you very much, Alice, for that answer, or rather elaborate response to our participant. I have somebody who is thanking us for the informative presentations. I would like to know, what is the resolution of blood reactions from the clinical setup? We always report to BTUs with all the required samples of urine and blood, but we never get feedback what caused the reactions. I tend to think rather the attendant want to know, after reporting, maybe from the clinical areas or other transfusing facility from the wards, after reporting that there has been a reaction, after the investigations that have been done, they don't get a feedback mechanism. Dr. Duranera, you are in a clinical setup?
From where I work and what we do is that we always report once the sufficient samples have been picked. We always screen the blood again, do all the necessary tests, and we report back. We even have an adverse reactions book, notification book, and in case anything needs to be reported back to KNBTS, we do that. I think somebody from KNBTS can say the practice there. Maybe Alice?
Alice?
Kindly, I'll pass this to Dr. Chege. Thank you.
Thank you. Dr. Chege? Dr. Chege seems to be a bit not responding, or Dr. Chege? Dr. Iflin? Now that at least she's not responding, I can allude to it as Dr. Tranera has talked about it, that this is in the clinical areas, and meaning that for us to strengthen our reporting systems is that if there is need for establishment of robust hospital transfusion committees in our transfusing facilities, because this is one of the activity or other requirement that HTC can look into it, so that at least when there is any reaction or rather the feedback for reactions, it can be handled by the HTC. Remember, Dr. Turanera talked about it, and most of our HTCs, we know that they are either marigold or they are not working. Dr. Mchana, do you have any comment on the same about reactions and how they are supposed to be reported and the importance of the HTCs?
Yeah, okay. From Kakamega, I think we have incorporated transfusion as part of our routine hospital continuous medical education. That's the CME every Wednesday. And with that, we have empowered our clinicians, starting the nurses, the clinical officers, and doctors on good transfusion practices. And this has really brought down the number of reported reactions. And many are not true reactions as in antigen antibody. Mainly is too rapid reaction, poor quality of giving set with clotting, and over time they are quite less. And we automated our grouping, so the number of wrongly grouped samples, especially the Reza's antigen, where we have the weak D, all those have been brought down. And I can say that we have reduced the number of reported so-called transfusion reactions. What I may add is with the NBTS, we had a partner who really strengthened the hospital transfusion committee. It is true, we have shortage of staff, and unless you have a partner who is really keen pushing the anesthesiologists and the surgeons, it may be difficult, especially for the administration, to push on the HTCs. So probably you can update us and on what kind of partner or plans you're having to have someone take up the HTC support within the facilities, because it sometimes is quite difficult enforcing it from the management point of view. You get committed to other things and you push blood to the back burner, yet it's quite critical. Thank you.
Thank you very much, Daktari. Thank you very much, Daktari, for that elaborate answer or rather advice to Evans about the feedback mechanism on suspected cases of reactions.
Wafira,
Yes, Daktari.
this is Dr. Evelyn.
Yes, Daktari, come in.
I understand you're looking for me.
Yes, on the same issue.
I've listened. I'm sorry, I was on another call. There has been a gap, and as has been rightfully answered or asked, what is the feedback mechanism? There is that gap. There's been no feedback. Previously, there was the HTCs, when they were working, they were able to investigate what happened through the whole processes, like as discussed on Wednesday and today in the quality webinar. There is need to investigate and fully investigate to make sure that there is a corrective action that happens and to prevent any other further occurrences. Now, we've realized that that is a gap, and as Dr. Mchana has rightfully said, it has been within facilities. It has been facility-based. They try and investigate amongst themselves. But how we are trying to do with the new guidelines, which will be rolling over in 2022, we'll come up with clear ways of how to do the reporting, how the investigations will be, and how the HTCs in the transfusing facilities will be able to resolve these issues. I think that is what is happening. Washira, you are a regional head previously in Nyeri. I don't know what was happening there as well. Maybe you can give us your experience as well. Thank you.
Thank you. Thank you very much, Daktari. My experience in Nyeri is that the key, or rather the way forward, is to have robust or rather active hospital transfusion committees. With this, we are able to address all those errors and all those concerns, particularly on matters transfusion within the facility. Remember, the HTC is a multidisciplinary function or rather body, and this one is also encouraged by the WHO. So this is the way to go, because a lot is happening in our hospitals setups. But the moment that we have this HTC, we are able to address them at the bottom line, or rather at the facility level. That is the thing, and I know very well that with the current administration, or rather leadership within the Kenya National Blood Transfusion Service, we will be able to encourage hospitals or transfusing facilities to have such bodies, or rather hospital transfusion committees. And it's going to be easier on enhancement of quality on issues pertaining to transfusion within the facilities. Somebody by the name Samuel Amkule, he asked for the difference between the hospital transfusion committee and hospital hemovigilance committee. Anybody in the panel that can answer that, please? Because I don't want to answer. Let us get it from Dr. Dranera.
Please repeat the question.
The question is, Samuel Mkule is asking, what is the difference between hospital transfusion committee and hospital hemovigilance committee. Is it one committee or is it different committees, or that are the difference? Over to you, Evelyn.
Okay, so the hospital transfusion committee has can co-opt or have several committees. In it has the quality in it because they have different functions, including hemovigilance of blood services within their establishment or within their center. So these are some of the functions. It can be a subcommittee. For now, I don't, maybe in somewhere place in, I think this is from Busia, maybe they have two separate committees. They risk duplicating the work. As we said on Wednesday, the HTCs, those are the Hospital Transfusion Committee, and it is not necessarily transfusion, a hospital. If your center does transfusion activities, it needs to have a transfusion committee. Under that transfusion committee, they are proper roles and responsibilities are given to your members. As Washira has actually said, it's a multidisciplinary team that involves everyone. It involves all blood users, including blood patient safety advocates as well in there. So in short, Samuel, it's almost a subcommittee of the HTC. That is the Hemovigilance Committee. Thank you.
Thank you, Dr. Sorry.
Yeah.
Thank you, Dr. for that. For my views, is just like yours, that we risk duplicating on issues pertaining to HTC. So for us, the hospital is supposed to have hospital transfusion committee, and the hemovigilance part of it is one of the activity for HTC. So I tend to think it's just a matter of twisting on the wording and so forth, but the correct version is Hospital Transfusion Committee. Others, thank you very much for that. My colleagues, thank you very much, participants. Thank you very much, our panelists and also our discussants.
I see a few questions in the chat box
there?
as well.
Are they still there?
We have John. We have John asking, regular, voluntary, non-remunerated blood donors is the surest way of getting safe blood. What is KNBTS doing to motivate regular?
Please, can we mute our mics except the person who is talking?
Yes. So what are we doing, Washira, as KNBTS, to make sure we have regular blood donors, the non-remunerated blood donors?
Thank you, Dr. What we are doing in KNBTS about having retention of the donors and having regular blood donors, non-remunerated donors, is that we have an elaborate way or department within, or rather section within the department that deals with donor retention and also donor education. And for us, we target, we endeavor to target voluntary or rather safe donors. And by that is that with the upcoming BMIS, that is Blood Management Information System, we are going to have an interaction with the donors. And also we are going to be encouraging them to be regular donors. These regular donors, remember, these are the people, or rather our donors, who know their status on issues pertaining to TTIs or transfusion transmitted infections. So we have an elaborate way of maintaining that at regional levels and also in the national level. And that system is able to maintain them and also to encourage them to continue donating. And also we share, or rather we give them their TTIs results and thanking them that at least their blood is safe and they can continue getting into our pool for safe donors. I don't know whether there is somebody in KNBTS fraternity who can add on that.
Washira, what do you mean by TTI?
Transfusion transmitted infections.
Thank you. It's because sometimes we may speak that way, and not everyone is familiar with some of our lingua.
You're right.
Yes. So
okay.
it's good we just say things in full for our participants to follow. I see there's a question that was asked. When are the other laboratories which are not accredited going to be accredited, Alice, or Robert can answer the question?
We do have Mombasa, Embu, and Kisumu RBTC that we are preparing to have them accredited.
Dr. Nyambila wanted it. There's a meeting is attending for contract.
Accredited under ISO 15189, and our target is to have the 3 sites accredited by June 2022. So preparations are on course. And again, I also did mention that we are also trying to see how we can have accreditation under Africa Society for Blood Transfusion that is now supposed to cover from the donor recruitment actually all the way to the bedside use, though some of those areas might be overlooked or eliminated in the accreditation scope basing on what we have control on. So therefore, there are plans, yes, to have those 3 other labs accredited and also maintain the status of the other 3 that are already accredited. Thank you, and back to you, Washira.
Thank you, Alice, for that elaborate answer, or rather our roadmap to full accreditation as a department. Somebody by the name Christopher Kivuva, he is asking, after blood donation, for how long can one safely donate again? I'll pick this one. After the blood donation, for men, you can donate comfortably after every 3 months. So an adult male donor can donate 4 times per year. And for female, or rather for ladies, they can donate comfortably, and this is science-based, after every 4 months. So they can donate comfortably 3 times per year. And we normally have a slogan that says, it is safe and it is saves. So it is safe to donate and it is saves life. Thank you. Anything, Dr. Evelyn, that you're going to get? Maybe my screen is not very visible. Any? Sorry. Let me also take this opportunity to thank our participants who are really saying that the webinar was very, or rather the presentations were very informative. And remember, as Dr. Dranera told us, is that you can go to the website for KNH and you're going to get all those presentations. This was the presentation for today. It was the 4th one, or rather section 4. So we have had 3 previous, and we are going to have maybe 2 more. So thank you very much for your comments, positive comments about the presentations. And we all endeavor to do that and also to provide Kenyans with safe blood. Allow me this time round, if there are no business, can I take this opportunity to welcome our technical head, Dr. Evelyn Chege, to have closing remarks, or rather any sentiment that she Dr.
So thank
Evelyn?
you, Ashra, for that. I like when I see the chat box is very engaging as we had today. We are sorry for the few technical hitches. We were able to have a smooth presentation today once Dr. Maturi was able to correct his mouthpiece. Now, we, as Washira has said, we are in a series. We have done 4 so far. We are inviting you all to the next one next week on 15th of December. That will be on Wednesday from 2 o'clock, 2 p.m. To about 3:30, 4 p.m., where we'll be discussing building sustainable delivery system for blood transfusion services. Some of our participants have actually asked us, how do we intend to make sure our blood banks are full? And the Director General will be joining us in that panel. So kindly diarize it, share with the rest of the participants who are not able to join us today. And yes, we look forward to seeing you all during that webinar session. Thank you very much and for the feedback. Asante sana. Back to you, Washira.
Thank you, Daktari, for that insights, for those insights that you have had. Let me take this opportunity also to thank all the participants, all the panelists, and to say that it was a elaborate. And I have also to take this opportunity to thank Kenyatta National Hospital and also the Ministry of Health and University of Nairobi for having this particular platform. And we look forward for more engagement in future, which is going to aid in our endeavor as we serve our patients and our clients. Thank you very much. Asanteni sana. You can leave at your own pleasure.
Thank you. See you on Wednesday. Thanks.
Thank you.
Thank